8 minutes late.
Doctor, I'm so sorry. I can't believe Joan's dead. Right. While I've got you, can I just say those pills you gave me last week made me ever so dizzy?
No.
And nauseous. I was wondering if you could change
Go
my
away.
prescription.
Hello.
Hello.
Condolences. That sort of thing.
Yes.
Your father's not here, of course.
No.
Good.
Can I introduce myself?
Well, you'll have to. He won't.
I'm Louisa Glasson.
Oh, yes. You're the school teacher Joan kept on about. I see you had the child. I'm Ruth, Martin's aunt.
Louisa, would you take her into the church?
Yeah, yes, of course. So, you're Joan's sister.
That's right. I'm sure Martin's told you all about me.
Oh, yes, of course he has.
Don't lie, dear. But if you must, do it with conviction.
Poor old Joan. That woman was everything to you.
Thank you. Of course, I saw it coming.
What?
Mrs. Norton's myocardial infarction. Signs are obvious to a pharmacist.
You should have said something then.
Didn't like to. Not my place.
Glad she didn't suffer. Well, just once, I'd like to deal with something violent. Something suspicious. Murder, manslaughter. I'd settle for a suicide.
Well, fingers crossed then, eh?
My condolences, sir, at this difficult time.
You're late.
Not really.
We should have started 10 minutes ago.
We got stuck behind some cows on the road.
Well, you should have allowed for that. Come on.
So, we have 6 pallbearers?
No, only 5. He can't lift heavy weights.
Yes, I can.
Well, you shouldn't, unless you want the next funeral to be yours.
I could go number 6.
Right.
Oh, I'm not sure about that.
Dad, I can do it.
Really? You don't think it might...
Oh, for God's sake, let's just get my aunt into the church. Al, come through.
Thought there'd be more flowers. Don't know why. Good turnout, though. Joan would be pleased. Well, if she wasn't.
Dead, yes.
Anyway.
Sorry, I'm no good at small talk.
No, that's all right.
My upbringing gifted me with a chronic case of social awkwardness. Middle child syndrome. Distant mother, overbearing father, and a succession of quasi-sexual encounters at a very young age. I either alienate or overshare. Just like now, in fact.
Do you see much of Martin?
Not much. We speak on the phone at Christmas. So, are you going to have another attempt at a wedding? You're not the type.
It's a little bit complicated.
You okay?
Yeah,
Did you hurt yourself?
I don't think so.
Well, get up then. All right, thanks. Be quiet. Take his place. You sure you're okay? Joan Norton died of a heart attack. Cardiovascular disease causes more deaths in this country than any other medical condition. Joan was overweight, refused to exercise, and had a poor diet.
I'll take him outside.
Cardiovascular disease is caused by a build-up of atheroma in the walls of the arteries around the heart.
3021 from Tango Delta, receiving. 3021 receiving.
Tango Delta receiving, go ahead.
The lorry shed its load on the A39. Can you deal? Over.
Stand by, stand by. I'll call you back. I'm in a church. No, it's a funeral.
A good percentage of the people in this church are clinically obese.
Oh, should I get some help?
I'm okay, thanks. It's my back. I pulled a muscle.
Oh, maybe you should go and see Martin.
I don't think I want to be disturbed, what with everything.
No, I meant at the surgery. See, he's here till Friday. Now look, I think I've got some paracetamol.
I've already taken quite a few.
Leave you to it then. Sorry.
Eating a healthy diet and keeping physically active not only protects your heart, but reduces the risk of a stroke or dementia. And that's all I have to say.
Hymn number 13, Abide with Me. Anyone drive a blue Merc?
So Pauline decided to give it a missing.
That's a bit of a drive from Bristol, and she couldn't get the time off work.
Well, didn't she tell the boss why she wanted it?
I don't know the details, Dad. These savouries aren't going to serve themselves.
See ya.
Oh, thank you.
I really don't see the point in this. I'm going home.
We've only just arrived.
Everyone's so busy drinking their free wine, they wouldn't notice if we were here or not.
I think I'll stay for a little bit longer, if that's all right with you.
Yes.
You all right?
Yes.
May I?
Yeah.
Never thought I'd be doing this with one of yours.
No.
Still no name?
Not quite.
You phoned Imperial?
Yes, I left a message for Robert.
Any mind if you stay?
It's only got to find a locum for 2 weeks.
Well, I'm very grateful. And it means you get to keep Martin a little while longer. Puts off the moment you have to fend for yourself.
I won't be fending. I'll be fine without Martin.
Oh, of course. I didn't mean food. I'm starving.
Yeah.
if you are staying for another fortnight, maybe we should move into the surgery.
Well, I sort of assumed that we would.
Yeah, I suppose it does make sense for us to stay together for the little time we've still got.
Well, if you want to prolong that time, then you could always come with me.
Well, yeah, but there's my job.
They have schools in London, small schools, with children every bit as dim as the ones you're used to.
Can I tempt you with anything?
No, I was leaving.
Then why don't you go?
I think I will.
Oh, I'll have something.
Bert Lodge, proprietor.
Ruth Ellingham, psychiatrist. Do you think I could have a glass of water?
Of course.
Martin, can you join me for supper tonight? I'm staying at the Crab and Lobster.
No. I'm moving back into the surgery. That should take up most of the evening.
Pity. I'm leaving first thing in the morning.
Actually, it might be a good idea if you hung on for a couple of days. There's a few formalities that need sorting out.
Oh, have to do some juggling.
Did you know that Joan left you the farm?
Oh, that bloody woman. And I only gave her slippers for Christmas. She was determined to get me out of London.
It's still an option?
Not without Joan. Thank you.
Right. No! Go away from here! Go! Go away! Oh. Get out! Out! You don't live here. Go! Right. Go away!
So, I joined a forum for new mums, posted a question on the website. Can I use this computer?
Yes, Louisa, you are aware that the internet is populated with self-professed experts. If you want some real medical advice, I think I could probably help.
Sure. Okay, doctor. So when you're breastfeeding, do you have a problem getting your baby to latch onto the left side?
Right, I'll take these upstairs.
Just fed him, and burped him, changed him, cuddled him, jiggled him. Nothing's working.
Is he hot?
He hasn't got a temperature, he's fine. Except he can't be.
Well, sometimes babies just cry.
Maybe I should get him a dummy to suck. Maybe that'll help him sleep.
No. A dummy will increase the risk of an ear or stomach infection, damage his teeth, and prevent normal speech development.
What time does the chemist open?
No problem with your eyes?
Just need some drops.
Maybe you're not used to sea air. Nothing quite like it.
It irritates my eyes and makes my hair lank.
Bite yourself?
It's just my tongue's sore.
You okay?
It's nothing.
It couldn't hurt to pop up and see your nephew, get it checked out.
Good advice, duly noted.
Breathe in.
My leg keeps making noises as well.
Be quiet.
Clicking noises. Shh.
Stay there.
It's only a repeat prescription.
Ellingham? Is it an emergency? Is it an actual emergency? Call back at lunchtime. Hello?
reception.
It's just
Take a minute.
waiting for Daddy's song.
Click, click when I go upstairs. Click, click when I go downstairs.
Is there anything wrong with your hearing?
That's clear as a bell.
Stop talking then. You have a mild respiratory infection. I'll put you on a course of ampicillin. The noise in your leg, does it hurt as well?
No, it just clicks.
Doc.
Get out! Take off your trousers.
Well, can't I just roll them up a bit?
I didn't say you could speak.
Hello? Oh, hi there, Sue. No, it's Louisa. Oh, dear. I'm sorry to hear that. I think I can see you on Thursday, 2 p.m.
Yes.
Right, yeah, I'll make a note of that. Hope you feel better. Okay, bye. Someone's got to do it.
Yes.
Are you going to look at my legs or not?
Go through.
Morning.
Chickens and young men. Joan had quite a menagerie.
All right. I'm Al.
Yes, I saw you at the wake yesterday. Al of the restaurant large.
Hey. I thought I'd better take care of Joan's livestock till things got sorted.
Things are sorted. Joan left the farm to me.
She loves this place.
Yes, now I have to tidy the poor thing away. Well, I suppose I'll stay for a week or so and then decide what to do.
Well, do you want me to carry on doing this, or...?
Oh, it doesn't look very difficult. I'm sure I can throw food around as well as anyone.
Well, the sheep will need feeding.
Oh, right. How many of those?
A dozen or so. Depends if any got out in the night. They'll need some water taken up there today. And most of the veg is ready for digging and, well, all the fields could do with a topping.
Right. Oh. Perhaps you'd better stay on after all. Thank you, Doctor.
No patients?
Well, Harry Pope said he'd be here by now. I'm not sure who else is coming this morning.
Is it too much for you?
No, I don't mind doing reception, just till you've gone. Back in a sec. Oh, and nappy sacks, remind me.
Dr. Rollingham, I brought my son to see you.
You're late again. More cows on the road?
No, we had a sudden cremation.
It wasn't like spontaneous combustion. We had it booked in for tomorrow.
Go
but then-
through. Not you, just the patient. You stay here.
But I'd like to know what's wrong with my son.
Then I suggest you speak to him after I've finished examining him. Go through. Stay there. Is your back still hurting?
Yeah, quite a lot now.
Then take off your jacket and shirt. Are you well generally, apart from your back?
I'm okay.
Any night sweats or fatigue?
I'm a bit tired, but then we've been busy lately. A lot of dead people.
Taking any medication?
Just some paracetamol.
Get on the scales. You lost weight recently?
No, always been like this.
Your shoulders are burnt.
Oh yeah, I fell asleep on the beach.
Off the scales. That side hurt more than the other?
Don't think so.
All right, get dressed. I'm going to need a urine sample. If the pain starts suddenly or develop gradually?
It was like I was stabbed.
What were you doing at the time?
Lifting weights in the gym.
How often do you go to the gym?
Every other day or so.
Why?
I'm trying to get a six-pack. Build up my muscle development.
Right, I don't need this filter.
All right, don't make a fuss. Come on, you can't possibly have hurt yourself.
It's my leg.
What have you done? Twisted your ankle?
Something went crack.
What the hell's going on? What have you done to my boy?
He pushed me over.
You tripped me up.
Why is he screaming like that?
I think he's fractured his tibia. I'll call an ambulance.
No. Don't bother. I'll take him to the hospital myself.
I think it'll be much
Just
better if-
help me carry him out to the car.
All right.
And whatever you do, don't drop him.
Mind your head.
Think some farmer might buy our scraps for pigs, Will?
No. You might as well throw that in there as well.
What's that then?
That's a bank statement. Have you seen our balance? That's rubbish.
Ooh. Well, that can't be right. We've had punters every night.
Well, they're not spending enough.
Son, no need to panic. When you've been around as long as I have, you come to know a thing or two about business. Now, every problem has a solution, and vice versa.
That's all he does, night and day, just sits there fiddling with it. I can't make him stop. I think those hands would fall off.
I see.
He's addicted. Those computer games ought to be outlawed.
Is this really a medical complaint? Ellingham. Hold.
What?
Would you rather be in bed?
No, I'm fine, Morrison. I just nodded off for a moment.
I'll speak to this person, please.
Yes?
Thank you.
Hello, so sorry to keep you waiting. Oh dear. One day might you like to come in?
Here, Al. Been doing some serious pondering.
Is that why you went down the crab, is it?
Do my best ponder over a pack or two anyway. It's a good thing I did. I took a look at their menu. They've gone all gastro.
Gastro?
Well, you know, pan-fried, locally sourced, served on a bed of wilted rocket.
Oh.
They hike their prices up and all. But don't worry, son. I got a plan.
Got a plan? Oh, God.
Hear me out, right? Now, they've gone up market, so we go down market.
How much lower can we get, Dad?
Well, there's no stopping us. We do traditional pub grub, pie and peas, sausage and mash, chips with everything.
And you really think that'll work?
Son, leave it with me.
Oh, all right, Dr. Ellingham.
There's no hot water at the farm.
Yeah, well, Joan was always having a problem with that boiler.
Like a bite to eat?
No, thank you.
We could rustle up a large plate of spaghetti carbonara. Try and get it while you can. Soon be heading down a whole new culinary avenue.
No. So what do I do? Is there a plumber in the village?
Well, I could have a look at it for you tomorrow when I come and feed the animals.
You?
I used to be a plumber with my dad.
Right then.
Son, we've got responsibilities here. What with the relaunch?
Al's doing a few chores around the farm for me.
Are you now?
Well, I'm just helping out.
Do you feel threatened, Mr. Large?
This psychiatry that you do, you got one of those posh clinics, you know, with the fish tanks and the cushions and the couch?
I assess the criminally insane at Broadmoor. Always on the lookout for a personality disorder. It's an occupational habit, sorry. Do you think I could have a glass of tap water?
Yes.
At this restaurant, two things are always free: tap water and a smile.
Yes? Come in. Yeah, it's you. Shut the door. How's your leg?
Not good. Gave me this envelope. Said you want to read the notes, see the x-rays.
Did you bring your urine sample?
Oh, yeah. Wasn't easy with these. I made a right mess. Had to wait for ages.
You say that as if it was my fault.
It was you pushed me over.
I didn't push you over. You got in my way. fracture like that's normally associated with violent twisting or direct impact, neither of which is applicable in your case. I want you to go back to the hospital.
Why?
Because a perfectly healthy young man shouldn't break his leg just because he takes a tumble. There's blood in your urine. You've probably got a kidney stone, back pain on one side. You'll need an ultrasound scan. And with a tibia cracking for no good reason, you need a blood test, check your calcium levels, and a bone density scan.
Will it hurt?
The scan? No. You pass a kidney stone, you'll know all about it, though. I'll prescribe you some painkillers. They'll help, a little. Drink plenty of water, about 3 litres a day.
You might think this is just a chemist.
Yeah, well, it is.
No, this is the first port of call for the sick and needy of Port Wen.
Yeah, although if there's something proper wrong with them, they go and see the doctor.
No, Dr. Ellingham and I work very closely together. He relies on me.
Yeah, sounds wonderful.
Oh, your first customer.
Hello, what seems to be the problem?
Well, see, I broke my leg.
Oh, and how did that happen?
I was riding my motorbike fast, daredevil-like.
Really? So a certain local doctor didn't fall on you?
Dr. Ellingham would never injure any of his patients.
Well, he kind of did.
I doubt that very much.
So, can I get these painkillers, please? Also, can I have some cod liver oil as well?
Only if you step back a bit. Bit more. Okay, now turn round and take down a bottle of mouthwash. For your fish breath.
Aunt Ruth, you do realise that vegetables grow on your farm?
If they leapt out of the ground and cleaned themselves, I might be tempted to cook them.
And are you going to stay?
For the time being. You know, Martin, I never thought you'd do serious medicine again. Makes me very proud.
Aunt Ruth, are you all right?
I'm fine. I must be off.
Do you want a glass of water?
I get simply furious if I don't have my dinner on the table by 6.
Do you have allergies?
My shopping, please, Martin. Love to the family.
Okay, that will be £620, please. Oh, hang on.
£9.80. Half which. Thank you.
Miss Glasson?
Hi there. How's the leg?
Yeah, still broken.
No more, Winter. I thought you got a job at the bakery.
Yeah, they gave me the sack. Thing is, right, they said I was eating more than I was selling, but
Sorry, I have to get back to the surgery. Can I just get some nappies, please?
Run out? Well, you'll soon learn the ropes, I expect.
I thought I had a spare packet. Then I couldn't find them.
Rowena, nappies. Come on, chop chop.
Hello, Master Ellingham. It's Master Glasson, actually.
That's right. He never did get married to your mummy, did he?
He's very tired.
Do it.
Perhaps we could come up to London at the weekends to see you.
No. It's a long journey with a small child just for 2 days.
It's true. Still, be nice to see you.
Well, I suppose if there's something he wants to do. The flat's just round the corner from the Science Museum.
What's it like?
You've never been to the Science Museum?
No, the flat.
Oh, that's on the 6th floor. It's about 900 square foot or thereabouts. There's a balcony with a view of the street. It's very clean.
Nice. Hello, surgery. Can I help you? Mr. Poe, calm down. Now, what's wrong? Okay.
Well, it's only 2 weeks.
I can't get a locum to fill in for just a fortnight.
Martin, there's an emergency.
I'm on the phone.
So am I. It's Neville Pote.
I don't care who it is.
Is this a bad time?
No.
He says his son's in agony.
Why?
I could call you back.
No, hold the line, please.
Harry's locked himself in the loo. Neville doesn't know what's going on in there.
Well, tell him to find out.
You're busy, so I'll be brief. George Melton's offered to cover your absence, but he's not flying back from Durban for anything less than 2 months. How would that sit with you?
You want me to stay here till October?
It would help me out my end, but obviously it's your call.
Apparently, Harry's now lying on the bathroom floor screaming like a baby. I really think you should go and help.
Martin?
Hello? Mr. Pote?
What took you so long?
What's the matter with your son?
Something came out when he was having a wee.
What, do you mean he passed a kidney stone?
You're the doctor, you tell me. Poor little boy.
You keep the stone?
Well, I just flushed it away.
Brilliant. Good God, what on earth are you doing? What on earth is he doing?
Well, I just thought I might pep him up a bit. I like to give him a blast on the sun lamps every now and again for the vitamin D.
Vitamin D?
Will make him stronger. I need him to lift at bodies and coffins, see?
I see. Never mind the risk of melanoma. A short walk in the sun every day would give you all the vitamin D you ever need. You smell of fish.
I take some cod liver oil every now and again.
Oh, do you? Is he taking anything else?
He drinks some of them shakes.
What shakes?
It's all good stuff. It's all very healthy.
Protein shakes? How many of these is he having a day?
He has one with every meal and one before bed.
Are you aware that excess protein consumption leads to acidic blood?
That sounds bad.
Yes, that's bad. To compensate for the acidity, the bones in your body release calcium, which means that the bones become weak and brittle. How many of these vitamin D tablets are you taking?
2 or 3?
Oh, for God's sake.
Yeah, but the vitamins are good for you.
Not if you take too many, they're not, you idiot.
Hey.
And you're a fool, too, for encouraging him.
At least I never broke his leg.
His leg broke because his bones are brittle. They are brittle because of too many protein shakes, too much time under a sun lamp, too many fish oil capsules, and too much vitamin D, which also gave you a kidney stone, by the way. Now, if you stop taking all this rubbish and burning your skin, you might just recover by the end of the year.
I'm sorry, I wasn't trying to... I just wanted to look good. I never had a girlfriend, see?
Oh, don't worry, son. You'll get one soon. You're a lovely boy. Isn't he, Doc?
Oh, God.
That's all right for you. You've got a wife.
We're not married.
Well, I'll do my best, but you might be looking at a new boiler.
Oh, can't you just hit the old one with a hammer? My sister thought that low-fat diets only happen to other people. Oh!
Arthritis? Yeah. My dad's got a touch of that.
Just a severe case of clumsy.
I once dropped a whole tray of glasses at the restaurant. I've gone there. You've cut yourself.
Oh, damn.
Let's have a look.
It's fine. Doesn't hurt.
Yeah. You should go and see the doc. I might need stitches.
No, I'm sorry. No, that's just not possible. 2 seconds. Because he doesn't make house calls unless there's an emergency.
Louisa!
Friday, 10:30? No, you can't make 2 appointments in case you're late for the first one. Because, well, it doesn't really work like that.
Louisa!
Fine. Yes. See you at 10:30.
Mrs. Crumbie's test results.
They're on your desk.
Well, I've looked. Please don't do that in here.
And where exactly do you suggest that I do it, Martin?
Whereabouts on my desk?
Can't remember every tiny little detail, Martin, but they're definitely somewhere in that room.
Oh, I see. So not necessarily on my desk, but definitely somewhere in this room. Excellent.
You need help with your baby?
I can manage, thanks.
Well, I could be the nanny or something.
But you already have a job.
Nah, not anymore.
Oh, what happened with Mrs. Tishel?
Nothing. Well, maybe it's because I called her a droopy cow.
Louisa, got a bit of a problem here, look.
Oh dear. Martin. Martin.
Come through.
Jabbed myself with a piece of glass.
Come over to the sink. I'll wash and disinfect it. Ooh. It's deep. Does that hurt?
No.
Well, I'll need to seal that. Hold that tight and take a seat. That didn't hurt.
No.
You can't feel that, can you?
Oh, leave me alone, Martin.
What exactly were you doing when you cut yourself?
Just finish up. I want to go, please. Thank you.
I'd like to do some tests after this.
I don't have time.
Oh, really? Is there a chicken that needs feeding? You're hiding something.
I'm dying. I found out 6 months ago. I've got lupus. Secondary systemic lupus.
Your mother died of that.
Oh, I'm sorry, Martin. You've just lost one aunt. This is the last thing you need.
What can I do to help?
Just be there. I know dying is the natural course of events. But Oh, please, can I have a tissue?
You don't need one.
What?
You aren't producing tears. What tests did your GP run?
Eye irritation, muscle weakness, and butterfly rash were on the symptom list for lupus last time I looked.
Did you diagnose yourself?
Yes.
You do any blood tests?
I didn't need to. You're not the only doctor in the room, Martin.
Stick your tongue out. Is this rash permanent?
Comes and goes.
Any seizures or loss of balance?
No.
You have inflamed eyes, you're unable to produce tears, and your mouth is dry. Your body is attacking its moisture-producing glands. I think you're wrong. I don't think you have lupus.
I think I do.
Then I'll take some blood and run your anti-nuclear antibodies. You have Sjögren's syndrome. It's easily treated. Saline drops, saliva substitutes. I'm sorry, Aunt Ruth, but you're going to live. Not indefinitely, obviously. I'll write you a prescription, and I've got some saline drops you can have.
Martin. Well, that's that then.
This house stinks. Regurgitated breast milk.
All right.
Oh, hello, boy.
Shall
Had to take Ruth to the docks. She cut her finger.
She okay?
Yeah. So, need a hand with anything?
All right, I'll take him. Thank you. Louisa, could I have a word, please?
Yes.
Thank you. I'd really rather you didn't leave the reception unattended.
It wasn't unattended. I was just upstairs.
The reception is downstairs.
If I know where it is, Martin, you're talking to me as if I'm a child. Do you have a problem with how I'm doing the job?
It's not a question of whether I have a problem.
Right, no, that's fine. Then I shall quit.
Louisa, could you take the baby, please?
That's not our baby.
A lot of my patients say they find a rural environment very relaxing. Of course, they also like it as a place to hide the bodies.
Well, you'd have no trouble getting rid of that farm. Everybody wants a house in the country these days.
I'm keeping it. Join me. I think the silence might be just what I need to finish my book. Or for that matter, to start it.
Well, you want me to carry on with the animals?
Oh, by all means. And you could help me do the place up. And there's rustic and there's shambolic. Is your daily rate exorbitant?
Well, not when you consider I'm handy with the plumbing, the carpentry, and the electrics.
I could use a little help here.
Right then. Cheers.
Cheers.
The most important thing is to make sure that patients with appointments go first and that Dr. Ellingham gets their file when they go in.
It seems a bit boring.
Well, it's not. Okay, it might be, but you said you needed work.
Yeah, I do.
So pay attention, and ultimately, it's up to Martin whether you get the job or not.
Who's this?
All right, I'm Morwenna.
Morwenna New Cross. I thought maybe she could be the new receptionist.
Is she qualified?
Depends what you mean by qualified.
I mean, does she have training or experience? Can she work a computer?
I used to work in a bakery.
Is that relevant?
Dunno, just thought you might like to know. Still get discounts on pastries.
And she's a very quick learner. And obviously you weren't very happy with me as the receptionist.
Well, that doesn't mean I want just anyone off the street.
I honestly think she would do a very good job.
Really?
Of course. And it's only for a few weeks.
Actually, no. It's for 2 months, at Robert's request.
Oh. I didn't know that.
Yes, I was going to tell you.
Is that good?
Weeks, months, whatever. Can I have the job or what?
No, of course not.
Leave it with me.
I don't trust him anymore. I think he's planning to do something to me.
Do as I do. Start the day with a strong brew.
Shut up and get out.
Put that down now!
Oh, for God's sake, what do you think I'm going to do? Throw it at you and hope you swallow some?
All right. Not ideal, but we can work with it.